Phase of New York's mental health mission, taking the unprecedented step of involuntarily hospitalizing people who may be a threat to themselves or others. Mayor Eric Adams says the plan combines action, care, and compassion to assist a very vulnerable population.
It is not acceptable for us to see someone who clearly needs help and walk past. For too long, there's been a gray area where policy, law, and accountability have not been clear, and this has allowed people in need to slip through the cracks.
So critics say forcing people into treatment could make matters worse. So here to weigh in on this topic is clinical psychologist Dr. Jeff Gardere. Good morning, Dr. Gardere. So good to have you as always.
Good morning. Thank you.
Well, I mean, as someone who's on the front lines and treats patients with mental health disorders, what do you think about this involuntary hospitalization aspect of the city's new plan?
Well, it seems to be somewhat of an earnest sort of effort to require people to get mental illness before they reach that overt act of demonstrating that they're violent, suicidal, or engaging in dangerous behaviors. So really what it appears that Mayor Adams and the administration is trying to do is making sure that these individuals get their psychiatric basic needs met before they end up unsheltered, unsheltered, without homes, or on the streets.
You know, there are, I guess, 5 pillars in how the city is going to deal with the mentally unstable, which includes this new hotline, right, Dr. Jeff, manned by specialists to help guide these mobile crisis teams and police officers. Do you think that's actually going to work, or are there going to be some issues here?
Well, I think it's a good effort in the right direction because what we'll see is that you will have patrols in the city of the NYPD, of New York City Department of Health and Mental Hygiene teams, which have clinicians on them, the cooperation, of course, of FDNY and EMS. But if a person is on this patrol, especially NYPD, and they need some sort of a consultation, then they can have this hotline. They can actually show a video, according to this plan, of what is going on with this person so that they can get a qualified opinion as to whether this person should actually be brought to a psychiatric hospital.
Yeah, I mean, people are wondering, when is it crossing the line, right? I mean, well, the Legal Aid Society says the approach is really too broad, and involuntary removals will lead to more arrests. But Mayor Adams says there is criteria to be followed. This is exactly what he said. Take a listen.
And we want to be clear, not wearing shoes, shadow boxing, talking to oneself. That is not the criteria. You know, we need behavior, and you cannot take care of your basic needs. We want to be very clear on that.
So some people are kind of guesstimating that there's going to be a lot of folks being brought to the hospital then. Are the hospitals equipped, though, to handle this influx of involuntary removals?
Well, my understanding is that 50 more beds have been ordered to some of these city hospitals. I don't believe that's enough beds if they're going to follow this plan in a very humane way, because there are still so many people who do need this help. But of course, as some of the folks who are part of Coalition for the Homeless are saying, maybe there needs to be more of an effort towards health and housing rather than involuntary removals. That being said, I believe that this plan, if it is followed in a humane manner, may actually help people who do have severe psychiatric illness and not waiting until something happens to someone else or themselves.
Okay, so you're using interesting words like severe mental health illness, right? Will this lead to people being committed when maybe they shouldn't be? Some might say that this could be holding someone against their will, and there could be a fight to get them to go get that help they need.
Absolutely. I think that there are going to be cases where people will be held against their will, and it may not be justified. And I'm concerned also that we already have implicit bias. We already have a lack of cultural competence in medical care in general. So what will happen when we have not just people who are part of the intervention teams, but people, police officers, and so on, who still don't have the training, even though they're going to get some real training according to this plan. Will it discriminate against black and brown people and others who are victims of implicit bias? So they're going to need to be really careful, Dan, with this plan.
Yeah, and perhaps down the road they might change the criteria. So this announcement, though, comes on the heels of that tragic case out of the Bronx that we just heard about, reported about, a mother acting erratically, now charged with the deadly stabbing of her 2 young kids. And there doesn't appear to be any history of violence in her case. So do you think a person has to be violent in order for them to be considered a threat to themselves or others?
No, they don't have to be necessarily violent. That is a key criteria, of course. But because they may be in some sort of a psychosis, for example, they may be neglectful of themselves. That can cause potential harm to themselves, but also potential harm to their children if they are not in a state of mind where they're competent enough to take care of their children. And I think that's part of what we may have been seeing here.
Yeah, and I think that there's a lot more to talk about, right? Because I think there's the mentally ill we see visually on the subways and things like that, and then there's a whole other gray area that you were talking about that we have to just discuss at a later time because we're out of time. And this is the very beginning stages, an ongoing conversation. Dr. Jeff, good to have you here this morning.